today I'm going to talk about lesser trelat sign. So before going to lesser trelat sign, we must know about seborrhoic keratosis. What is seborrhoic keratosis? Seborrhoic keratosis is a skin growth, brown or waxy black. They're waxy and brown or black skin growth on face, head and neck region. So these are caused by proliferation of keratinocytes and production of keratin. So they are very commonly found in age group more than 50 years, and if they occur in elderly patients, they are called dermatosis papulosa nigra. Nigra means black. Dermatosis papulosa nigra. So this is a very common finding. Seborrhoic keratosis is a very common finding. If it occurs in very younger age group, we should think about something sinister or doubtful. These seborrhoic keratosis are normally harmless, and if they suddenly occur rapidly and increase in size and number, we have to think about internal malignancy or any hidden malignancy or metastasis. So here now comes the sign called as lesser trelat sign. Lesser trelat sign is a sign when there is skin disorder characterized by the abrupt appearance of multiple seborrhoic keratosis that occur in association with underlying internal malignancy. The browny waxy skin growth. They often occur with malignant acanthosis nigricans. So we can say that lesser trelat sign is a paraneoplastic syndrome, part of paraneoplastic syndrome. What is this paraneoplastic syndrome means? If a tumor is there, if it's not diagnosed or if it is hidden, sometimes uh, some lesions like seborrhoic keratosis can occur in underlying malignant conditions. So that could be an indicator for internal malignancy, but not all cases of seborrhoic keratosis are related with malignancy. Abrupt sudden appearance of brown or black skin overgrowth. These waxy growths are harmless, but they could be an indicator of internal malignancy. Then we have to do investigation for internal malignancy or hidden cancer or undiagnosed cancer. So it's therefore called paraneoplastic syndrome, which means skin disorder that arises from remote effects of primary tumor or its metastasis. So if a seborrhoic keratosis occurs with internal malignancy or hidden cancer, it's called lesser trelat sign. Then the sudden appearance of seborrhoic keratosis in young patients points to a paraneoplastic process and should prompt an investigation for a hidden cancer. So, what's the clinical picture of seborrhoic keratosis or lesser trelat sign? They're brown, warty nodules with a stuck-on appearance. The indications of lesser trelat sign include sudden development of seborrhoic keratosis that increase in size and number over a short period of time. Second indication is usually it occurs in almost 35% of cases with malignant acanthosis nigrans. So, in 35% of cases of lesser trelat sign are associated with malignant acanthosis nigricans. Third one is eruptive seborrhoic keratosis appearance in age group less than 30 years. So in younger age group it can occur. So there might be eruptions and they appear as if they are stuck, that is sticked to the skin. So it's associated with pruritus, that's itching in 50% of cases. So treatment, there is no need for treatment of seborrhoic keratosis, but this could be an indication of internal malignancy. So we need to Look for internal malignancy if all the three indications are seen, if any of these are seen, and we have to treat the tumor. Then the seborrheic keratosis or lesser trelat sign, the treatment of the seborrheic keratosis, there's no need for any treatment. But if it interferes with wearing of dresses or clothes or ornaments or for aesthetic reasons, they can be removed by surgical procedures like electrocautery, cauterization, then cryotherapy, then laser surgery. So, if in usually many cases lesser sign, the cancer would have progressed or advanced. So usually the prognosis is poor, and the average survival is less than 1 year or 10.6 months. So lesser sign is very important. We need to know that seborrheic keratosis, if it suddenly appears on head, face, head and neck, or else in age group 30 years, less than 30 years age group, then sometimes malignant acanthosis nigricans, if it's associated with that, we need to look for underlying malignancy. This finishes the lesser Tourette sign, which is a paraneoplastic syndrome. So paraneoplastic syndrome means signs or symptoms which occur along with malignancy, either hidden or diagnosed. So this finishes lesser Tourette sign. Meet you or see you in next video. Kindly please subscribe to my channel and like and share please. Thank you very much. Bye.